Good morning. It is so nice to see each of you early this morning. I am Camille Vaughan. I'm the Division Director for Geriatrics and Gerontology, and this FAME grant expanded workshop and coaching series was something I got us doing a few years ago. So it's really nice to see it continuing. Thanks, Sarah, for keeping it all organized and running smoothly. And I'm delighted that you all are each participating. It has, I think participating in the series and doing the coaching, if you're participating in that, definitely help you get a proposal that's got a great shot at getting a good score during the review process. I'm going to pull up a few slides. I'll share these afterward because they do have some writing examples in them from previously funded FAME grants and that have been provided with permission from the applicants. And so, just be aware that you'll get them afterward. And it takes just a minute for me to figure out which screen I'm on. Okay. And is it showing in the presenter mode or the
nope,
like?
It looks good.
It looks good. Okay. Mm-hmm. All right, so we'll jump on in. Just quick recap of, and you're seeing the next slide advance, right?
Yes.
Okay, perfect. So quick recap of kind of the couple of topics you've had before today's session, which is the last one in the series on evaluation methods. We'll talk about the development of a SMART goal. You may use these even in your practice. There's a type of goal setting that's been shown to work even in like motivational interviewing, for instance, or and behavior change. But I do think the framework of developing a SMART goal helps you get a really nicely defined aim or goal for your study for the FAME mechanism. We'll talk about some types of studies that are common for the FAME grant and are doable in the 1-year time frame with 20% effort that the FAME grant provides. And then some resources are available to you as Emory faculty for data collection, management, and analysis, which will make things a lot easier when you're doing the project. Because again, most of the funding is really for your time. So it depends on kind of what's available in your division, or if you happen to receive like the health services project and they are helping to fund a work study student, often a lot of this is going to be up to you as far as the data capture and management, and so you want to know how to do that well and efficiently. All right, so your first session with Laura Plantigo was on developing the problem statement. This is also known as a study, a specific aim often is really thinking about what is the gap in the current knowledge around the area that you're working in, whether it's in mentorship, educational development, research, quality improvement. What's the gap that needs to be addressed that you can do in this 1 year of time to start down that path, and why is it important? Those are like two big things that you're going to need to quickly convey to the reviewers. And then I also recommend giving a glimpse of the aims of the approach that you're going to use to address that problem or aim in your aim statement. And so I'll show you some ways that you can do that with examples. And then I think Pooja Mehta covered the background and significance. This is where you get a brief page or so to again expand a bit on why, again, what's known in the field, where the gap is, and why it's important that we address this with your project. So it's that, so what? Why do we need to figure out the mechanism of XYZ? What is that going to lead to down the road? Because really what we're hoping, and what's been shown with a lot of the past awardees, is this 1 year, 20% time often leads to other opportunities, another funding project, new, leadership roles, because you've shown what you can accomplish. And so you want to be thinking even ahead of like, what am I going to do once I get the findings of this project? So I'll share with you a few of the common kind of critiques related to evaluation during the FAME grant review process. The number one, and that's one I really, really, really hone in on, is that the proposal is overly ambitious in terms of scope. So I'm going to, again, throughout this talk about ways to, what might look feasible, again, in 1 year with 20% time, which is roughly a day a week. That you're going to have protected to do your projects. You really want to think about something that's doable in a year and with that amount of time. We really want to see evidence that you've thought through the steps of the methods and how you're going to achieve them, to show that you've got, it's feasible to recruit the population if that's part of your project, or it's feasible to gather the data you need to be able to do the evaluation, or if you're doing chart review, that it's actually going to be feasible based on the number and the plan that you have for data extraction, chart abstraction, to actually get that done. So we want to see some evidence of feasibility. We want to see that the evaluation tools that you're using, let's say you're going to administer a questionnaire or that kind of thing, is there something that's validated in the literature that you can leverage? Or are you using something you're creating? And if you're doing that, we want to know that there are ways to make sure that it's valid as a measurement tool. So these are some things to be thinking of. Again, it doesn't take a lot of space to explain this, but if you can hit on these details, it's going to really show the reviewers that you've thought through all the components of your project, the steps, and that you're ready to both achieve the project, but also handle any delays or things that happen, which almost always happen. And then I recommend including a timeline, or what's called a Gantt chart, where you have like a matrix of all of the different things that you need to do during your project, and you show on a timeline of like when you're going to get those things done. And I find that that's helpful even in the development of the project. So say you're proposing you're going to recruit 20 people for interviews, or to do an intervention that you're proposing, or you're going to do interviews with students or trainees that you're working with. Show how many you're going to need to recruit each month or each quarter to achieve that number of 20. And sometimes you realize that after you've gone through all the prep work and you need to have time for your data analysis, getting 20 in maybe 6 months, maybe that's doable, or maybe that's a little tough. And you want to say, maybe I could get by with, 18 or, something like that. So there's some things like that creating that milestone chart can kind of help you. And as you're thinking about the components of your project too. If you do not have experience or in the area that you're thinking about working in, showing that you have, either your mentor or another member of the team who's willing to work with you for that. Like, let's say you're planning to do a focus group. If you've never done a focus group before, there is a methodology to that. And there is a way of thinking about how you're going to analyze the information from that, the data from that. If you want to have someone on your team who's going to at least coach you through that. And so thinking about who those collaborators are that you need to engage, and that they're available, because there's not going to, again, be any funding for their time, figuring that out early is important. And then if you're going to need to do more of a quantitative analysis, again, clearly kind of stating what the analysis plan is for that. And if you're not sure, again, either talking with a collaborator or engage the data analysis core from the Department of Medicine, which all of us have 10 hours a year of time that we can leverage, that's subsidized by the department with that group. And you may want to kind of connect with somebody there, or again, someone in your division, to talk about what an appropriate analysis plan is for your, project. And then I do think a few sentences in the proposal showing how you're going to overcome potential barriers is really important. And again, just shows it's a well thought out project. And there will always be some sort of barrier that comes up, and you don't want it to be something that would totally kill your project. I mean, that's not the type of barrier. But, what if you have a delay in recruitment? Or what if, the samples get stuck in the mail, or I don't know. I mean, it could be a variety of things, but you want to kind of think through what are some of the pitfalls that might come up that wouldn't totally prevent me from doing the project, but might delay things, and how would I handle that? Okay, so this is the SMART goal framework, and I'm going to just use this as a way of thinking about how to take a problem statement, or an, otherwise known as a specific aim, and make it really clear to the reviewer what you're going to do, and kind of how that important is that problem is important kind of in a very succinct way, in a very specific way. So if you're addressing each of these components in your problem statement, you're going to have a really succinct way of giving the reviewer a great idea of what your project's going to be about. So again, specificity is really important. Kind of, who is the population, why what you want to do, where it's going to be done, and then if you can give a little taste of why it's important. What's measurable? What are you measuring? Go ahead and put that in the aim statement as best you can. And then if you can, even give more specificity about the target that you're trying to achieve. And then once you've decided on that, make sure it's doable, again, within a year. And if anything, maybe a little less than a year, right? So that you can do your analysis during that time. Giving some idea of why this is a really important, again, relevant problem. That's the so what. And then the time frame has to work within this 1 year of project that you're going to have. So I'm going to show you some examples of, ideas of an overall goal, and then how we got it to a SMART goal. So this project is what became the Equipped Medication Safety Program. And it started out as a FAME grant to Melissa Stevens a little over 10 years ago. This is a program that overall improves prescribing safety toward older people who are being discharged from the emergency department. So Dr. Stevens' goal when she started was to improve prescribing toward older adults in the emergency department. Okay, that sounds really important, but it doesn't actually tell you much about how you're going to do that. What's the target? Can we actually do this in a year? This kind of thing. So changing this kind of overall broad goal to a SMART goal, this is where we actually ended up. And this was after talking with people in quality improvement, looking at some of our baseline data, getting an idea of what an appropriate target might be, determining what criteria we were going to use to decide that prescribing was improved, right? And so it takes some time and analysis of the literature and your own, current baseline to actually get to this SMART goal, right? So what ended up coming through for the first aim of this project was to reduce the use of potentially inappropriate medications according to the Beers criteria. So you're telling the reviewer, this is the metric I'm going to be using, or the benchmark, to a goal of less than or 5% of prescriptions written for older adults discharged from the ED each month. Okay, so you've got your time frame there, you've got your target, you have your population. So it's not just all older adults seen in the ED, it's people who are being discharged specifically. You've told the reviewer kind of what your criteria are going to be. So again, it's not a whole lot more as far as length, right? But it's a much more specific goal with a lot of detail there that gives the reviewer a good idea of where you're going to be headed with the proposal as they read on. Okay, here's another one. This was a kind of idea that we had. This was not a FAME grant. This is from my own kind of work, where we were just interested in whether vitamin D levels were associated with urinary symptoms in older adults. Okay, kind of interesting maybe, but doesn't, again, give us a lot of detail about what we're really going to be looking at. So if you think about a SMART goal for this idea, we're going to say, well, low vitamin D, and we're going to tell the reviewer exactly what we're going to define low vitamin D as. So here, less than 20 nanograms per mil is associated with incontinence. So we're getting more specific about which symptom we're talking about, occurring at least monthly. So we're telling kind of the amount of, incontinence that we think is clinically important. And we're going to focus on older men specifically. Okay, and that might be informed by what's in the literature already. Here's another one. This is from a FAME grant from a few years ago. The goal of the project was to reduce hospital readmissions from skilled nursing facilities. Boy, that sounds important. But again, not a lot of specificity about exactly what they're going to do, right, in that aim statement. So again, after, thinking about the project, the goals, looking at the literature, seeing what metric they're going to use, this is what kind of came from that overall idea to an actual SMART goal or specific aim. So the project focus was to analyze the effect of a discharge template on quality of discharge summaries through chart review. So telling your methods right there in the aim of pre and post intervention discharge summary. So they're kind of telling you they're going to do this, as a pre-post evaluation, right? Already, to see if they accurately convey the TOCCC, which is Transitions of Care Consensus Conference. So you're getting an idea. This is some sort of evidence-based, consensus panel type checklist that's, been validated in the field already, that it may be, it gives you an idea that this awardee is going to be doing something that's going to be recognized in the field more broadly as potentially valid or important. And they're going to do that, use this checklist to, again, evaluate these discharge summaries pre-post. Now, I would say an even more specific way or detailed way to add into this one would be to actually say what your benchmark's going to be. So they're going to say, well, what is a high quality discharge summary? And you might put in the aim even more detail. Again, that's going to convey at least 90% of these checklist items, for instance. Okay. Any questions on these kind of ways of making your goal of your project quite detailed in a succinct way, so that the kind of from the get-go, the reviewer knows what you're planning to do?
Hi, Dr. Vaughan. This is Anand Shah.
Yeah.
So one of the, I'm thinking, so I'm going to do a QI project, and if you go back to the, on this discharge template, on the quality of discharge summaries, like it sounds like that's a QI project, but where they're already coming up with the proposed intervention, maybe based on their baseline data. But with QI, yeah, you based on the baseline data, but then you continue to do PDSA cycles, and your interventions might change. So, is that supposed to be represented in the SMART goal? Is the expectation for this to already have these interventions outlined, or is it? I think the part that I'm struggling with for putting it together a QI grant is how much is the reviewer going to be focused on seeing what the proposed interventions are versus looking at the run charts, understanding of the data, doing, the typical QI reviews at a certain interval.
I think they do want to see a plan. And I think it, obviously Equipped was a QI project as well. I mean, we know that the plan, that's the fun part about doing QI, is you aren't bound by a protocol, exactly. You have what you think you're going to do. And then sometimes it shifts a little bit based on, how that goes when you start to roll out, whatever your planned intervention is. I would say though, that for the FAME grant review process, I mean, I have been a part of this for the last few years. The committee often wants to see some sort of action you're going to take, versus just describing the situation. So they're not usually as interested in, we just want to describe what the current state of, this problem is in our system. They want you to have a little bit of an idea that it is already a problem. And so you do need to often have some, small amount of baseline information, either from your own practice environment, or document maybe, background in the literature that this is a persistent problem in the field, so that it's pretty clear that this is very likely a problem where you are. I mean, it's really better if you've got a little bit of a baseline information that shows that whatever the issue is that you're going to address is problematic in your setting of care. And then I would say that you do want to propose what you think may be a solution, and that might be based on prior, literature of what's worked in other settings. And then you can acknowledge in your, pitfalls, kind of not pitfalls, but in your, like, what if this doesn't work type area of, we're going to be doing this through PDSA cycle, which is a framework for QI. It's always important to use a framework, right, in general. And then if we encounter a problem with this aspect of what we're planning to do, we will adjust, and these are the ways we might adjust. You can even go so far as to say that.
I gotcha. So more or less kind of speculation on for future interventions you might focus on, but kind of describing the methods, fishbone analysis, run charts, Pareto's, in which you might get there.
I think that's right. Yeah, those are certain QI frameworks. It's helpful to show that you've got a process plan, right, for doing that. But I would try to go ahead and propose what you think you may end up doing for the kind of change step. And that, again, may be informed by what maybe is in the literature already has worked either in other settings or, like for equipped, for instance, the Beers criteria were an evidence-based criterion that was used to evaluate prescribing criteria in a lot of settings of care. They're a validated set of criteria for really all settings of care. And there'd been certainly work in, inpatient settings, outpatient settings, long-term care, using those criteria to evaluate prescribing quality. It actually, though, there was very limited literature of what had been done in the emergency department setting. So it was a setting of care that was different. But, we were using a set of criteria that were well evidenced and believed, by the field. We also proposed a method of doing the kind of trying to change prescribing behavior that was called audit and feedback, which is a well-evident strategy that AHRQ recommends. So, there were things that were like, we think this is going to work. Now, of course, if all the providers are really annoyed and we don't have time, they don't have time and they're not paying attention to audit and feedback, then yeah, you might think about other ways that you're going to try to change their behavior. But, proposing a strategy that's been shown to work in, antibiotic stewardship or, opioid prescribing, but we're going to apply it to this, this particular setting and this particular problem, is a way to show that you kind of have done some homework of what you're planning and proposing to do.
Understood. Gotcha. Thank you.
Okay, so that's some information. Oh, go ahead. Sorry.
Yeah, this is Avi Cole. I'm a
Yes.
hospitalist at Grady. I have a question about the problem statement. Is that so right now I have a page that has goals and then specific aims under that. Is problem statement supposed to be like before is it like even broader than your goals?
I mean, the problem statement is very much tied to the specific aims. When I'm writing a proposal, sometimes I'll even say the long-term goal is this, the goal of this particular project or research area for this project is going to be this, and then here are our specific aims of how we're going to get there.
Okay.
Is one way to kind of think about it.
Okay, so you would have like a little blurb or a paragraph with the overall goals / problem statement and then specific aims underneath that.
You could. I think you want to get to the aims of your project pretty quickly. So, the reviewer, you're trying to grab their attention with that first page where you're kind of laying out what the problem is and where the gap is. Mm-hmm. And then quickly getting to your specific aims of what you're going to do to try to address that gap. Okay. In a 1-year project with 20% projected time. So, we have all kinds of grand ideas, I think, of all kinds of big problems that we want to solve, but you've got to come up with something that's a next step forward that's doable in a year with 20% projected time. So that's always the challenge. And that takes a little time, right, to kind of think through. And once you get to a specific aim or a SMART goal, these are kind of terms for the same thing, that's really, succinct and describes what you're planning to do, you're going to look back and be like, wow, I spent a bunch of time thinking about that, what I wanted to do and what criteria I'm going to use and how I'm going to measure it. And I ended up with this one sentence, but that one sentence is one of the most important sentences on your whole project. Okay.
Got it.
Okay, so I'll kind of come back to this SMART goal kind of framework throughout as we talk about some of the different types of projects that often are funded under the FAME mechanism. Okay, so one of the most common is what's called a feasibility study. So this might be where you're looking at some sort of maybe new intervention. but you know you're not going to recruit enough people to demonstrate any kind of efficacy or potentially even know necessarily a whole lot beyond just some broad brushstrokes of how they respond to that intervention. So the main goal of a feasibility study is actually, is the population I'm interested in trying to intervene upon willing to tolerate my intervention or even participate in a study? Can I recruit the population? Can I show that the protocol that I think is going to work is actually possible in the current setting? Maybe something similar has been done in another setting of care, but can I show it's workable here? Or maybe I'm working through the specifics of a protocol for an intervention. And so this is usually going to be, you know, maybe less than 20 participants or so. And is, you know, you can even, you know, you could even do a randomized study in this type of, in a feasibility study. But again, your outcome is really about, can you recruit, retain, randomize the population? It's not necessarily about the outcome measure that you're maybe most interested in down the road. So you're kind of getting data to help inform the next grant or project that's going to give you a larger budget and allow you to do a bigger study. So your methods for a feasibility study might just be descriptive statistics. You're often using, if you're going to do any kind of comparison pre-post or between groups, you're using non-parametric statistical evaluations that are for non-normal data, because you probably won't have enough of a sample to have determine whether your data are normal or not. And you might be looking at qualitative data, so doing some interviews or focus group maybe to see, again, some of that, what's not contained in a survey. So fleshing out kind of your findings from the quantitative side with kind of that more detail that's really rich that we can get from qualitative data. So this is a sample, an example of kind of the describing briefly the methods that would be used in a feasibility study. And this is from this is from something that's probably larger than a FAME grant, but it's the kind of idea of why you might do a feasibility study or what your outcomes are going to be. So for this, we said that we were going to determine the feasibility of a multi-site randomized controlled trial test. So we're still doing a multi-site, you know, this is a larger project, but you still could do a randomized design even in a feasibility study. But again, here we're trying to, and we're looking at our intervention. We've got an intervention we're kind of, you know, we think is what we want to move forward with. But you'll see the evaluation has nothing necessarily to do with the outcome related to the intervention. It's about, having a fidelity to the intervention across two sites when you've got different interventionists doing it. It's about the acceptability of doing maybe, interviews and surveys, for instance, if you're thinking about that for an outcome evaluation. How many, what resources are needed to recruit and enroll the population. And here we were looking at older people who had both insomnia and nocturia, which is kind of a newer population for these interventions. And they were looking at whether we can randomize them to either a treatment group or a control group. And that's a big problem sometimes, is if you have dropout and that's differential, maybe the control group is not compelling enough for them to stay in it. And then can we keep them in a 5-week study? So that's kind of a description of what a feasibility study might look like. Okay, how about a pilot study? Now, a pilot study is actually a little larger study usually than a feasibility study. And here you are starting to get interested in your outcome. But again, you're not going to be doing a study that's large enough to tell efficacy, that an intervention works, right? And no one should be doing a study to try to evaluate efficacy in a FAME grant. It is not, I'm just telling you, it's not possible to do that large of a study with 1 year and 20% time. So this is probably as large of a study as you would get to really start to look at some sort of outcome measure as your measure of, definitive interests. Okay. So here you might be looking at the variability of response, getting an idea of whether there's some signal that your intervention works relative to some sort of control or usual care. it's showing again that you can conduct the study at some level, maybe at one site. And it's really giving you some of that data needed to go maybe for the larger mechanism. Okay. And even in a QI project, I mean, with Equipped, we actually had really strong results initially, and we were able to leverage that to get some VA funding to expand the following, kind of within the following year. And then down the road, we actually were able to leverage those results to get funding from AHRQ to do a larger kind of study, as well as more of an evaluation than we could do in the context of kind of the 1 year funding. So it's, again, this is about thinking about the scope of what you can do in kind of this 1 year, 20% protected time. Again, your methods here might involve descriptive statistics again. You could have non-parametric or parametric tests, because usually a pilot study is going to have about 20 participants or so. And so you're getting to the point that you may be able to determine if you have normal data or not. And then you might, again, use qualitative data to really help give you that, reading between the lines perspective that the quantitative data just don't always tell you. Uh-oh, hold on. So here's a brief example of methods of rationale kind of for a pilot study. So we said, while this pilot study will not include a sample size large enough to identify all clinically meaningful improvements in incontinence, that's urinary incontinence, we believe that the screening and enrollment process, as well as completion of 20 carefully characterized subjects, will yield valuable preliminary data for determining potential effect sizes and sample size necessary for future studies. Okay, so you're kind of telling them you are going to be focused on your outcome assessment, but you're not looking at it from a perspective of efficacy, but really getting an idea of variation and how much a potential effect you have, so that you can help determine a sample size for the next study. Okay, in thinking about quality improvement projects, which are a great opportunity for the FAME grant, again, I encourage you to use some sort of quality improvement framework to describe the methods you're going to use. We already heard about kind of the Plan, Do, Study, Act, which is perfectly appropriate. That is a framework, right? And so cite that and reference it in your project. VA TAMIX is one that VA promoted a few years ago. I think they've also kind of transitioned to focus more just on language, acronyms that are known throughout the field, regardless of VA. So PDSA is appropriate for VA as well. Lean methodology is another one that could be cited. And you might look at tools available from the Institute for Healthcare Improvement to, again, leverage what's already in the literature. You really should not be developing novel methods necessarily, unless that's really your niche focus. You should be using what's already been done and has been shown to work as a framework for why the rationale for what you're proposing to do as an intervention or strategy. Okay. If you're thinking about an educational initiative, consider using published questionnaires that will help you for getting, again, showing validity, which helps get you published down the road. If you want to, go into the peer-reviewed literature with your project results, look at other, besides the peer-reviewed literature that's like on PubMed, you may also look at MedEd Portal, which is another peer-reviewed place that educational curricula are published. And again, you want to get a sense of where the gap is. Okay, so we don't necessarily want to just do the same project that someone else has done unless you really feel like your setting or your population is different, and that's okay to do that, and that might be the case, right? But you don't want to just redo what someone else has already done and has shown to work. That's not going to be considered novel, really. And again, trying to advance the field. You want to find what's the gap and how is what I'm doing going to help address that gap. You may or may not need IRB approval for an educational initiative. It really, again, depends on whether you're proposing like a brand new strategy or pedagogy, for conveying this important content to your learners, then you might need IRB approval because you're really generating brand new knowledge. If you're doing something that's more quality improvement, that's really institution specific, this is unique to the Emory, environment, then, and you're using, again, published resources, then that may be deemed more of a quality improvement type project, and you don't need IRB approval for those. Now, our IRB does have a process of giving you a letter showing that this project has been deemed quality improvement, but the IRB doesn't review it. They're just saying that, you are a faculty member at Emory, you've determined this is quality improvement, and they're giving you kind of an IRB, a letter from a note, the IRB has said that's fine. If you need IRB review, though, you have to put in your project for IRB review. So that's a little bit of a difference. If it's quality improvement, it doesn't go through an IRB review process, but there is a quality improvement kind of letter you can get from the IRB, and they have, I'll give you the link for the IRB kind of information on quality improvement. But if it's a research project, yes, you will need to go through some sort of review process. Often these projects are, don't require like full board review. They may just go to a member of the committee. And I would look at the IRB's definitions because they have been getting a bit more specific. So for instance, chart review, I would say a chart review studies, might need, it depends. They might need IRB review or not. But if you're doing like case studies, the IRB is kind of determined if it's like a case series, if it's more than 5 charts, they actually do want to see those sometimes. So it really kind of depends on the project. If you have questions, look at the IRB's website. They have a lot of good information. If you still have questions, feel free to reach out to me or Charlie, or, we can get somebody in the department to kind of provide some counsel on that. Okay, so in thinking about data sources, you've got a lot of different options depending on what would work best for informing your project. So first are, to consider surveys or questionnaires. We've talked about that. I would try to use some sort of validated survey or questionnaire if possible, or at least adapt one that is published. It just shows generalizability potentially to also other literature that's published in the field. And survey and questionnaire development is like a whole methodology to itself. So, we want to be thoughtful about that if we're going to use something we're developing. If you're going to do that, think about, again, feasibility of doing this project in 1 year or 20% protected time, and you might not have anybody else really helping you. So you're also going to need to do data entry and learn to, what's your data entry platform going to be? Is it just going to be an Excel spreadsheet? Are you going to try to use RedCap, which maybe is a little nicer for getting the data out later? How much time is that going to take you to do data entry? Those are some considerations. So I would not recommend doing like 150 questionnaires if you're the one that's going to be doing the data, and certainly try to be more parsimonious. You might not want a 50 question questionnaire, right? For a lot of reasons, but also for data entry. So those are just some things to be kind of thinking about, in details that you can put in your proposal in just a few, words that show the reviewer that you thought through this, so that you're kind of, whatever you are proposing is feasible. Maybe you're going to be gathering data from one of the clinical data warehouses from one of our health systems. So Grady, Emory Healthcare, VA, very rich resources for gathering data on the clinical populations that we treat. So knowing a little bit, this is some of your background and homework, or what are the variables that are available. We talked about a vitamin D project. Sometimes the name of a vitamin D lab draw changes over time, and so you can have like 50 different variables that all measure vitamin D level. There's some things like that that can get kind of, in the weeds, but important to know, because if you only pick one of those and there are actually 50 different ways that could be named in the data warehouse, you've just missed a whole lot of data that you need to have. So knowing if you're interested in social determinants of health, knowing which social determinants of health are captured in your data warehouse is really important, because it would be lovely to be able to get, educational level, right, on every person in your sample. But if that's not captured in the data warehouse in a way that you can extract or analyze, then you may have to come up with some sort of proxy. So there's just things like that doing against some of this homework is important before you put the proposal in, because a lot of the reviewers may have an idea of what's in the data warehouse. If they can tell that you didn't do your homework, that's going to be one of those things that kind of says, I'm not sure they're really ready to go, right, with this 1 year project. I mentioned this earlier, but if you're going to do any kind of interview or focus group, and sometimes there's a rationale for picking one type of qualitative evaluation over the other. So think about that too. I mean, a focus group can be helpful to get a lot of data all at once, but that means you have to coordinate, an appointment with multiple people all at once. And the dynamics in a focus group, if you have somebody who's really talkative, they might overtake the whole thing. Whereas maybe interviews are more time consuming and you have more data you have to transcribe, but you might get that introvert to really open up and tell you some really rich information. So there's reasons to think about different methodologies if you're going to do some sort of qualitative evaluation. That's why it's really helpful to make sure you've got someone on your team who can coach you through that if you're going to be doing a lot of it yourself. There is a methodology to consider, and even how the discussion questions are written. You're going to have to do transcription, coding. If you've never done that before, it's definitely could be fun to learn that methodology, but just don't assume that's something that can be done well without someone kind of guiding it who does have expertise in that area. And then again, mentioned the department's data analysis and biostatistics core. We all get 10 hours free per year. They could help you with some of the pre-work if needed. They can help with data extraction. If you need something more than that, what's that 10 hours per year? It's pretty reasonable, but it is something where you might need to find out what the cost is going to be and maybe talk to your division director about whether there's any little bit of supplemental funds that could help if you need to pay them. And that's not going to be paid for by the FAME grant. So either that's coming from a designated, if you have a personal designated account, or again, some divisions might have a little bit of supplemental, like on the hundreds of dollar range, maybe. And that's where you want to kind of talk to your division director about what your project is and if you think you're going to need any little bit of extra. Measures. So some things to think about. There are a lot of different evidence-based assessment tools out there available to you. This is the Promise Measures website, which is a whole set of validated patient-reported outcome measures that NIH has endorsed. And so if you're looking at any kind of patient-reported outcome, you might check out the Promise Measures, because again, it will help you, if you're going to publish this or move on toward a larger grant, be using measures that could be compared to other studies, or that your reviewers someday when you're outside the Emory system even are going to say, oh yeah, that's the best measure to use. And this study is going to be really important because it's going to tell us, what this population that's new and novel, how they're responding to this, intervention or treatment or whatever. So that's a good place to look, again, as you're looking for measures that are already out there in the literature. Okay, statistics is always the scary part, right? So for again, most of you will, if you're recruiting any kind of population or using some sort of chart review to characterize a population, if you're doing a intervention with students and you're gathering survey data from them, you're often going to be using some sort of descriptive statistics to talk about, maybe age, sex distribution, possibly race, ethnicity, if that's relevant, maybe some sort of clinical marker. So you're often using descriptive statistics to describe either the mean or median of your sample. You might use a median if you have a really small sample, because again, you may not have normal data yet. You're often going to be comparing either proportions or means in your comparative statistics. And it's important to be able to show confidence intervals, which gives you some idea of the variation around that mean. Or in medians, you'd use your 25th to 75th kind of range, percentile range around that. Comparative statistics are when you're starting to look at, either within a population, a pre-post change, or if you have two samples, like in a randomized study, you're comparing between these two separate samples. That the t-test is the most common, again, for normal data. If you don't have normal data, then you might be using some sort of non-parametric evaluation, like Wilcoxon ranked sum test is basically a t-test alternative when you don't have normal data. So if you have a really small sample and you're looking at medians, for instance. If you have proportions, like you're comparing the sex distribution between your samples, you might be looking at chi-square instead as your statistical evaluation. And then if you have count data, so like in our prescribing projects, we're really looking at numbers of prescriptions, then Poisson distribution might be more appropriate for doing your statistical comparisons, because that's really designed for count data. So this is where, I mean, you might have, if you've, done some additional training in these types of statistical evaluations, you may have that expertise, but often the reviewers are going to be looking for what you're going to leverage to help make sure your analyses are done in with rigor. Okay, thinking about sample size, there's a lot of considerations for sample size. There may be, if you're really trying to estimate the effect size, think about how many you're going to need. You often need at least 20 to be able to do that. If you are really just doing a feasibility study, or you're doing mostly qualitative evaluation, a sample size of 10 might be enough for interviews or focus group to get an idea of saturation of themes that come through from those interviews. So this, again, might be, you want to talk to your mentor or others on your team to get a sense of what the appropriate sample size is based on the type of project that you're doing. If you're doing chart review, I always say this, chart review always takes more time than you think, okay? I don't recommend any project have more than 100 charts you're going to review. And that's that even would be a lot. So you might think more about the 50 to 100 range, if that will be enough of a sample size for you to get the data you need for your project. Chart review is more time consuming than you think. You have to do the data entry as well, okay? And the biggest thing on chart review that can be a barrier is not knowing all of the variables you want to abstract at the beginning of the project. So this is another thing where you might include, I can't remember, Sarah, if they're allowed to have like an appendix or a supplementary table in their FAME grant application.
Yes.
They are allowed to?
Yes.
Okay, I will just tell you,
yeah.
a really savvy project, if you're doing a chart review, would to be include an appendix that might give an example to the reviewer of what your chart abstraction form looks like. So go ahead and draft out the variables that you think you're going to need to pull from your chart review. That shows, again, you've done a lot of thinking about this project and you've got something that's feasible. It's like the downfall of a chart review to have your chart abstraction form and then realize halfway through your chart abstractions, you've forgotten to include this critical variable that you must have to do your project. And now you got to start over, do it all over again. So that's the kind of thing, again, it'll save you time when you actually get to the beginning of your 1 year, 20% protected time that you're going to get to already have drafted your chart abstraction form. And it'll show you've really thought about it when you get to the review. What's available to you for data management or data collection? Lots of free resources, actually, and this is nice. So Excel, of course, we can all use Excel. I personally not a huge Excel fan. There's a lot of room for human error in the data entry with Excel because you can't create like these fields where it says, well, maybe you can now. I'm also not an Excel guru. But, you want a field where it's like, you can't put in like an age of 450, right? It should be 45, or whatever. So you can put some different things like access. You can actually put parameters on a field and say, if somebody tries to enter, 450 for an age, that is the form's going to say, no, that's an error. So pick up things like that. Those, again, are things that just drive you nuts when you get to data cleaning and the analysis phase and you're ready to get your analysis. And you're getting like a range on your age variable that says you've got a standard deviation of 100, right? That means something in there is wrong. And you're going to have to go clean that up before you can get on to the fun part, which is looking at your results. So access, REDCap, those are ways where you can use, it takes a little more time maybe to set up, or you might need to engage someone with data management expertise. Again, think about the data analysis core or talk to your division director if anyone's available in the division. But it could save you time on the back end because you have a more robust data capture system. And if you're thinking about a next project, you've already got, you've learned how to do that with this FAME grant. REDCap is now free for Emory researchers, which is huge. It used to be $25 a month. You can also, if you're going to do survey data, Qualtrics is free for Emory faculty, and RedCap can also do surveys. So those are ways that can be done securely and meet kind of some of the, if you're going to need to do a consent, meet some of the security requirements the IRB is going to have for data related to to those capturing systems. And then I2B2 is a data analysis. It's really I find it most helpful for kind of the preparatory to research. So let's say you're planning some sort of project, like let's go back to my nocturia insomnia project. I2B2 is a way to look at de-identified data through the Emory Clinical Data Warehouse in a pretty fast way. So you do have to be on Emory campus, like you have to be on the network on campus or go in through Emory VPN. So I was at the VA yesterday kind of refreshing my slides, and I just couldn't get into it yesterday, but it's because I was not on VPN. But you can basically query the Emory Clinical Data Warehouse for some broad variables. So like I could put in, I want to see all men and women 65 and older who have a diagnosis code of nocturia and insomnia. And you can start getting a sense of, and then it's going to tell you how many subjects there are within a certain time frame that have those diagnoses that meet your criteria. That can be helpful for saying, you know what, there are like 5,000 patients in our health system who have these diagnoses, and I'm only going to need to recruit 20 of them for my project. So we've got plenty of sample available. I could get this done. So it's, again, just some things that are available. If you actually need to do a data extraction, you know, you will need to get usually IRB approval for that, which shouldn't take too long. And then you'll need to have someone who has access to the data warehouse to pull that data for you. Again, Department Data Analysis Corps can help figure out where to get you, you know, where to go, or you might have someone in your division. So those are some things to think about if you're thinking about a database project. Okay, so a few things on sample size. This is from another FAME grant to give an idea, not just of how many people I'm going to recruit, but the feasibility of doing that, who I'm recruiting, and what I'm going to do if, I'll show you on another one, what I'm going to do if there's any barriers to recruitment, okay? So this applicant said, I'm going to use purposive sampling, which meant that they were looking that people had to meet certain criteria. They're not just putting a broad call out, but they defined what their purposive, which is a hard one to say, sampling was going to be. They're going to use the sampling to recruit 10 people who will be identified from the group with the goal of achieving a balance of men and women, Black and white race, and older and younger ages. So again, giving you several details about the population that they're recruiting and what, you know, some of the things they're going to do to make sure it's a representative, right? In just a sentence. They said the goal number of participants in the group is 6 to 8. So we're going to go with 10 in case we have any dropouts. Again, addressing a potential barrier in one sentence. These patients will be invited to participate in a focus group, telling you they're going to do a focus group, right? It's going to be led by the PI and an additional physician investigator. So giving you some sense of who's going to help do this. Next, they wove in how they're going to address barriers. They say a focus group guide based on loss to follow-up literature. So they're telling you they're using an evidence-based strategy to develop their guide will be used to structure the discussion. And they have an appendix. Okay. So you can, you know, you can't overuse the appendix. We'll see through that. But this is one way, again, if it's not going to fit in your page limit, to maybe have a little bit of additional detail that, again, just shows that you've really thought through all the components of the project. The session will be conducted, left a letter out there, conducted in a conference room at Grady Hospital in the last 60 minutes. Again, just some details, right, about how this is going to go. Patients will be offered refreshments. So that might address some of the barriers of like, are they really going to come? Like, what are you going to do to really make sure the population will attend this? And we'll give them reimbursement for public transportation. Session will be digitally recorded and the results transcribed verbatim. Again, few sentences, tells you who you're recruiting, how, what you're going to do to address potential retention, methods you're going to use, who's going to be involved to do it. A lot of detail in about 4 sentences. Okay, here's another one looking at mixed methods. This is where you're using both qualitative and quantitative. They say based on the results from phase 1, questionnaire is going to be developed. Reasons for loss to follow-up identified by the previous, patients that we interviewed. Questionnaire will include 10 reasons for loss to follow-up with a 3-point Likert scale. Likert scales are generally determined to, those are often valid measures just to include a Likert scale. They tell you what the ranges will be. They're going to have 20 participants, including focus group, that they'll be invited to participate in phase 2. Questionnaire is going to be administered by a physician investigator. Telephone administration methodology was chosen to reducing participation barriers. So they're telling you why we want to do a telephone. And the interview will be structured and based strictly on the questionnaire. They go further. This is a bit of detail, just showing you, though, how you can do this in a few sentences. They also mention that they have a member of their general medicine faculty who has expertise in conducting and teaching qualitative research who's going to serve as a consultant. So they're showing they've already got that person on board. Okay, because somebody might say, wow, this looks a lot of detail. Is this, applicant ready to handle this approach? And they're kind of addressing that head on. And then they say they have a physician statistician who's experienced with this cohort who's going to help with the statistical analysis. Okay. I mentioned a timeline. This is the, maybe the type of Gantt chart that could be done for a 1-year project. It's broken out by quarters. It goes by different objectives. There are things that you need to accomplish throughout the year, and is a way of, again, just showing in a succinct way and a little bit different than a paragraph that you've kind of thought through all the steps that you've got to accomplish for the reviewers. And then this is the link to the IRB's QI determination process. I would review this. A lot of the things that we do are not research. They are quality improvement. And so you don't have to have IRB review for those, but the IRB will provide you a determination letter, which sometimes a journal wants to see that you considered at least whether it was research or not when you're getting to the publishing phase. You can publish QI. That doesn't determine whether it's research or QI, but it's more about whether you're trying to generate new knowledge or you're really taking evidence-based information and applying it, like maybe in a different clinical setting, and so your findings are really relevant for the setting. Okay, I think that kind of takes us to the end here. Again, I'll send the slides to Sarah that can be distributed. Any quick questions here right at the end?
Thank you, Camille. Sorry I got here a little bit late, but of course, very helpful talk and for this particular application. I do want to clarify about appendix because you mentioned it several times.
Right.
I mean, I would say in previous years I have not seen appendix materials in my FAME grant applications.
Yeah, I honestly not sure that applicants have always gotten to that level of the detail yet. So, if you don't have time to show, like if you're going to do chart abstraction, you don't have time to pull that together. Again, it doesn't mean you're not going to get funded. These are things that can be more compelling, I guess, to show, like maybe interviews. If you have a draft of your interview guide, it doesn't have to be the final, but it just shows you've kind of thought through some of this already, and it just adds a little bit of detail. I think the one example I showed there that mentioned an appendix was a FAME grant. So unless the criteria have changed, that's why, and Sarah can, we don't want you to try to circumvent the page limits with an appendix.
Exactly.
That is not appropriate.
Exactly. But, yeah, that's what we're concerned about. Yeah.
Yeah. But if it's a, 1-page example of a chart abstraction form, I think that's often allowed in.
Yeah, the reviewers do not want to have more pages to review unless something like that you can kind of glance at, right, as a reviewer, and make a judgment on whether this is valid or not.
Yeah.
And
again, finalize it
and
as you go through the IRB process.
In grant, in grants, other grants other than the FAME, you use the appendix to, like for the American Heart Association, for example, you give a recent publication that you have or letters of support other than your mentor's letter, right? So you really don't want to use, like Camille is saying, use the appendix as a way to get around that page limit for your application. That would not be looked favorably upon by the reviewers, I would say.
Correct.
We are over the time limit here, but are there any questions, any last questions? I imagine some of you are meeting with your mentors, or you should be, right? Sarah, you got breakout rooms going here. All right, so the deadline
Okay.
for your letter of intent is the 31st.
Yes. So Tuesday is the deadline for the letter of intent. And then the 28th of February is the full application. I'll
Is
go ahead.
everybody clear on that? Yeah.
All right. And if you are meeting your FAME coach, I have breakout rooms. I'll go ahead and open those, and you can move into those and meet up with your coach here. That breakout room should pop up at the bottom of your screen, and you can move yourself into the rooms.